How do you feel about people exercising when they're through pain? Should they exercise with pain? Should they not? Should they?
I would say mostly no.
Okay.
You know, I think there's a couple things that we see on the PT side where we're like, this is going to hurt, and I apologize in advance. So if anyone's had total knee replacements, they know that that's the case. Adhesive capsulitis or frozen shoulders, that's another situation. But oftentimes, if you're having pain, it's your body's way of telling you that something is going on. So I would say for the most part, no. You know, a lot of times, even initially, I'll have people work through a pain-free range, basically. So they might do something that's a similar movement pattern, but they're staying within kind of that pain-free range. So I don't think, you know, at this point that it's, you know, like pain is a good thing or whatever. You know, what is the little
no pain, no gain. That's
gain.
a lot
Yes,
of people's
that's exactly
aspect,
right. I would say
and
no. I would say, you
false
know,
statement.
Oftentimes when people have that mindset, it just gets worse, and then they come and see us, and they're way worse off than what they would have been if they would have came a few months prior to.
Hey, what's going on? Welcome to Healthy Living Wichita podcast with Go Time Training. I'm your host, Raymond Elliott, lead personal trainer at Go Time Training in Northeast Wichita, Kansas. I've been in the fitness industry for over 20 years now, and I've seen it all. This podcast cuts through all the fads and gimmicks to give you a science-based truth on all things fitness and nutrition, so you don't have to try to figure it out on your own. If you want to live happier and healthier and get the scoop on how to work out, eat right, and keep a positive mindset, you're in the right place. It's go time. Now, let's get to the show. So Healthy Living Wichita, we are here back again with another podcast. I have no idea like what number this is. Like I'm like 12, 13, 20, something like that. But we're back again. So hopefully you guys listened to all of them. And we're here with my amazing friend, client, guest, Julie Gawith.
Yes.
I practiced your name like 12 times. I still don't know if I got it right.
That's
but
all good.
Julie's an amazing person. She works super hard, and she really helps out a lot of our clients. So I won't go into too many details of what she does. I'll let Julie kind of introduce herself since you probably know you.
Yeah, I do know me. Yeah, so I'm Julie, like you said, owner of True Physical Therapy. We've been open just over 5 years now, just down the road at 21st and Webb. Have a super awesome practice, lots of dedicated team members. And so, yeah, we're just excited to be a part of this. And thanks for the invite.
Yeah, we appreciate you so much, Julie. Julie works with a lot of our clients, so we are referrals basis for each people. So we send a lot of people her way that needs to be referred out because we're not physical therapists, as many personal trainers out there like to think they are. And that's what her expertise is, and she really gets our people back healthy, or we can come back in there and take care of them. So we appreciate that.
And vice
so
versa.
much.
Yeah, absolutely. You guys have done a great job with our patients after PT. So I appreciate that too.
And I think those are kind of good topics to talk about. We were talking just a second ago. 90% of people are in pain. A lot of people have different aches and pains as you grow and get older and do stuff. Those things seem to happen to the human body.
Yes, unfortunately. That's exactly right. I was laughing the other day. I had a patient tell me how funny it is that when you're a kid and you get injured, you're doing something crazy like, I fell off the trampoline and broke my arm, or I was riding my bike and crashed and broke my leg. And as you get older, it's like, I bent over to tie my shoe. Right. I turned to look out the window. And it's like, oh, man, how quickly things can happen as we get older.
It's amazing, yeah.
So, absolutely.
It's crazy how I can go through exercise here, or even have a client and they did deadlifts that day and they're like, yep, I went and picked up a pin. But I think one of it's a little bit of intention. You know, when you're going through those things, when you're doing an exercise, you're focusing on your form and technique. And then we're out in real life.
Yep.
And I'm sure you go through that things all the time with
absolutely.
people. Blow out their lumbar picking up a pin, but can deadlift 200 and some odd pounds like you.
Sit on a beanbag chair, you know.
Right.
Things happen.
This is very much true. So just kind of wanted to talk to you a little bit about, since you work with a lot of people that obviously have different injuries and different situations that you have to help recover, how important do you feel like exercise is as far as a prehab or preventative for people with pain?
Yeah. Exceptionally important. I mean, I can't say enough about it. Obviously, that's one of our big focuses. Just our mission as a PT clinic is, you know, once we get people back to the pain-free, zone, is then getting them to understand how important exercise is just as a part of their everyday life. And that's where, we utilize you oftentimes. I've been into, strength training all of my life, and through, undergrad program and then going through PT school, have realized how important strength and stability mobility is, just for, a preventative side. And then on top of that, some of the things that we do at the PT clinic is some screenings that look at full body mobility and stability.
Right.
And I think that's really important, similar to what you guys do with the functional movement screen with your guys' clients. We use the selective functional movement assessment, and that is super beneficial to allow us to kind of look at the full body perspective and see what limitations they have. Because oftentimes, the pain is the last thing to show up. You have a lot of limitations and restrictions prior to, and what your red flag is, oh my gosh, I have pain. But what you don't know is you have a lot of limitations and deficits prior to that. So I think that's really important, just to maintain, good overall strength, stability, and mobility, just to help to prevent any injuries from coming. And then also we see people prior to surgery too. So that's another thing to kind of bring up. We've actually had a lot of that lately, pre-total knee replacements, pre-ACL surgeries that have came in just for a few visits to allow us to educate them on how to get some mobility back, to start working on some strength and just kind of awareness, to allow them to have a little bit more successful rehab for after surgery as well.
Yeah. So you feel like people that do obviously exercise prior before him have a lot better rehab
without a doubt
later on.
Yes, absolutely. Absolutely.
So we actually just, one of our last podcasts, we were just talking about all the benefits of weight loss, or not weight loss, but exercise, and how a lot of people just focus on weight loss.
Yeah.
So that's kind of nice, and that's one that we didn't miss, is like if you do get injured or do have to go in surgery, your recovery could be a lot better after that, especially if it's something that's more orthopedic, I guess.
And I think that's a shout out to you guys and what you do, because oftentimes in the personal training world, they just focus on sweating and losing weight, and it's just kind of like no matter how you do it, get there, And I think that's something that's really important for people when they're looking for a trainer, or when they're doing exercise on their own, is to really determine what are their deficits and limitations, and then address those things. It's not just about 60 minutes of hard cardio and sweating their booty off, but really finding those things that are going to help them, because that's going to make a big difference in terms of your everyday function too.
Of course, yeah.
So
and can be preventative, and as we know, when you're hurt, me and you both have had to downgrade our workout a little bit, just because we're going through some injuries, and so we can't put as much into it, which is still great that we're doing those things, and it's an inherent risk to being human and exercising. But if you can prevent those, then your ability to do higher intensity for a longer time, which would correlate to probably better progress and goals in those aspects. So
I agree.
Yeah, and I think functional movement, like you said, a lot of times people want to get, like we were talking about, prehab or preventative. People want to address something once they're in pain, but there's all kinds of things that led up to that. So if you're not really focusing on that, and I doubt most of our viewers out there are probably worried about a functional movement screens, and if they have proper movement patterns, and if there's muscular imbalances and some things that you know a lot more than I do, even with the neurological aspects, probably that's not a focus when they go to exercise. They're just, what can I do to kick my butt and get me better, composition, so I feel more confident, but you don't realize how much those movements.
Yeah, I agree. I had a situation specific this week where a younger kid, going to be a senior in high school, went to his MD just for his sports physical, and they sent him to PT within the next couple days. He had some aches and pains, but nothing real significant. But they noticed some limitations in his movement patterns. And, he came and kind of was the typical high school kid that was like, I don't really know why I'm here. And so I took him through that movement screen, and it was amazing how many limitations and restrictions I found in his mobility. And then as I was poking around and whatnot, found some areas of tenderness that he was a little bit less aware of until I pointed it out. But the biggest thing there, I think, is this kid is out playing tennis and basketball and doing these things, but has significant restrictions in his motion. And then, right now it's not a big deal because he's 17 and he's not obviously most of the time going to feel those aches and pains. But as you start getting older and start, realizing how much that limited you and caused you some long-term effects, I think it's really important. So pointing those things out to him was eye-opening, and now he's, stoked, as I would say, to start some PT and get after it. And even if it's just a handful of visits for me to be like, hey, these are some areas that you can focus on to use as kind of a warm-up, prior to jumping into your sport, to work on your restrictions and mobility, because they were very significant restrictions for sure. So
I'm really surprised that in sports that they're not looking at those at that level as much, but it's like, it's funny you say that because like I would get like, hey, you got a high school kid coming in and he plays basketball or he plays football, and I'm just like super excited because we do a lot of general public and I love dealing with that.
Right.
But sometimes
It's
you're like,
fun.
I'm going to get this kid and I'm going to be able to go crazy and do all this, and then you put them through movement screens and you find that there is a lot of limitations and restrictions, and you're like, holy, this guy's 17 playing sports, and I really need to start a stability, mobility phase with this person and really get this person's form back. And I have to train them, like I would do my 50 and 60-year-old clients that, that are going through some aches and pains. So it's amazing. And sports, they're looking at that now. Now, like if you had two prospects and you say you had a pitcher that threw 100 miles per hour and that was amazing, but you had a pitcher that threw 90 miles per hour, but that pitcher's form is a lot better. Investment's going to be in that person because this person within the next couple of years might have to have Tommy John surgery. So professional teams are looking at movements.
They are. They're doing movement analysis a lot more now. I just had this discussion with a guy last week that was talking about some of the different equipment they're utilizing now to be able to determine, injury risks for the, elite athletes, professionals and whatnot. But I think it needs to be done a lot more throughout just the community, like even with the high school kids and whatnot. That's something that we as a PT clinic kind of have a passion for. Most of us, I think 4 of our 5 therapists played college sports. And so we're, obviously really excited about college athletes or high school athletes or whatnot. But that's something that we notice, you see these kids coming in, high school girls specifically, or junior high girls that have these ACL tears, and you look at their movement patterns and you're like, well, no wonder she tore her ACL. Right. How she didn't do it sooner, I don't know. Or how, she didn't do it on both sides, Right, and so those are things that we look at quite a bit in terms of the rehab process, is not only getting them back from the surgery that they've had, but then working on the symmetry side to side and working on their overall just like awareness of, how to squat and how to land and jumping mechanics and being able to control their knee position and things like that, because those things are really going to make a huge difference. And going through an ACL surgery or something similar is super traumatic for kids. That's quite a process and takes away, a lot of your love for the sport and confidence and being able to do things. And so if you can prevent it, I mean, that's huge. I think that's a big part of our job as PTs and your guys as trainers as well.
Yeah, because I actually went to a pain-free performance session, and they were really talking about like those mental roadblocks, and they're basically like if your body feels injury, you might not perceive it, so you might not consciously perceive that, but your body is, and so it's gonna maybe downgrade a little bit more of your performance. I think I even feel that now playing softball because I've torn my hamstring so many times. Like I run hard, but my body's down like, hell no, you ain't gonna do that, bro. Like I got you. So we don't even subconsciously know that. So for people in those ages that can't get past that kind of fear, there's maybe a deep-rooted fear. So if you can keep from ever having those situations,
absolutely,
you're fine. And as we know, like you said, girls, we talked about Q angle a little bit today, but girls a lot of times are more susceptible for ACL tears for multiple reasons.
Yeah, and then you look at that. I mean, obviously the athlete side, but we'll see people that'll come in that may have had a surgery years back, and they're like, well, my doctor told me I could never squat again. So they're very apprehensive to do certain things, certain movements, and that's not necessarily the case. It's just, helping them to develop to have good biomechanics and being able to do those things safely, Right. And there is certain surgeries that do limit your ability to do things, but I think oftentimes people can get back to move fairly functional movement patterns.
Right.
They're just very fearful of doing that.
Of course.
And so for us on the PT side, easing them into things, educating them on those things, and giving them good like foundational strength and stability to allow them to move into things that are they're feeling more confident for. Yeah, it's so important. So.
I never ever got that. I mean, not saying anything against doctors, but I've had a lot of people that came in. I had a client not too long ago that has a L5 S1. And that he was told he's never deadlift again. I was like, we're going to deadlift. And not saying that I would ever go over recommendations of doctors, but we're going to do some form of that because of like, do you pick things up? Like, do you squat to get in your car? Like,
that's right.
How are you never going to squat again? You might not squat again with a barbell on your back for 600 pounds.
Absolutely,
but if you plan on ever sitting down and getting around, you probably need to learn and do how to do it safely so you don't injure yourself again. So it always you kind of give people a problem sometimes when you tell them they can never do something again,
and then they feel like they can't bend over to empty the dishwasher or tie their shoe or something like that. So I think that educational side of things is really important.
Yeah, and you guys do an amazing job on that in teaching people the reasons why we're doing all these things, which is huge.
Yeah.
So what is some common, so we always try to give some help out there. Maybe you can give like a tip. What is like a real common thing that you see, and maybe one thing that somebody could do to help benefit? Putting you on the spot here.
I know.
Because we're like, what are we going to do?
Goodness,
What are we going to talk about? I was like,
right.
see, it's not hard.
Yeah,
but is there a very common injury you see? Lower back, shoulders, I know
so
are becoming.
I would say that's exactly what I was going to say. Those are probably the most two just common like everyday injuries that I can think of is, subacromial decompression, so shoulder pain, rotator cuff tendonitis, like that, those type of symptoms. And then I would say low back pain. Those are probably the most two common, just people come in and saying, this hurts and has been for a long time sort of thing. So, so with shoulder pain, I think the biggest thing that you could do preventative.
There's no one fit all.
Well, I know. So postural exercises, I think, is really important. So a lot of the times that we see people with shoulder pain, they have, desk jobs or something where they're doing a lot of anterior, like forward head, forward shoulder type positioning. So some strengthening exercises to work on your back, the like posterior aspect. So we get so tight and restricted through the pecs. So stretching out the pecs. So whether you're doing like a doorway stretch or corner stretch or things like that. I like to do some stuff on the foam roll. So those work really well. But then doing just some, oftentimes, especially people that are active, they do a lot of chest strengthening exercises. So push-ups and bench press and things like that. But doing some reverse things, so more pulling type movements. So doing some rows or some like tees, we call it prone tees, standing tees, whatever. And some more endurance-based like rotator cuff strengthening. So lots of external rotation type exercises. So that's obviously very broad, and it's different for everybody. But I would say in general, those are things that we see quite a bit. And then in terms of low back pain, core stability is obviously huge. So kind of going back to the posture, I've seen a lot of patients lately, just kind of an interesting point. I think that people get so caught up into having proper posture that they think proper posture is really going up real tall, belly button stuck out, and then they get hyperextended through their lumbar spine. So they're almost kind of the opposite. So being able to kind of separate, having good scapular retraction, but not necessarily overextending the lumbar spine is really important. So yeah. So I work with people a lot on that, like having good scapular retraction, but at the same time, that doesn't mean that you're getting a lot of lumbar extension. So core stability, pinning those ribs down tight to the hips is something that I cue people with oftentimes to make sure they have that strong, stable lumbar spine, but they're still getting good upper body posture. And then I would just kind of like to, I guess, reiterate the importance of core strength and making sure that you're doing more stability-based strengthening stuff for the core and not necessarily a lot of repetitive flexion like crunches and things like that. Right. So obviously we do a lot of stuff in quadruped, like hands and knees type position, plank type movements, things where your legs and arms are moving, but the core is staying strong and stable. And I think the other thing that people need to just be aware of is with strengthening, almost everything you do is strengthening your core if you do it correctly.
Right. Yeah.
So you can have a nice, strong, stable core and never do any crunches, but doing, like push-ups or doing like bench stuff. So upper body stuff, going back to like rows and hip hinge and things like that. All of those things that you do, if you are being aware of your core, that is strengthening and stabilizing. Right. So
I think a lot of people still, like when we think about the core, they think of the rectus abdominis, and like when we think of the core, that's really the we're not really thinking about that. We're taking more TV, like deeper core muscles and stabilization muscles. We're thinking about the whole
oblique,
trunk,
erector spinae, glutes, all of the above.
All those fun words. Google, guys.
I know, that's right. But your tummy, your back, and your booty all makes up your core. So
and we're like you said, working on stabilization. So we're actually doing like anti-movement. We're trying to control not doing movement a lot of times to help stabilize it, which is what your core mainly does. It helps prevent load, right? I always think about like your core is kind of like creates that pressure like a ridge, like a can, and then you can create that that internal pressure like what a bottle with a lid on it. Like you can't crush it, but you take that and then it just crushes down.
Yeah, so, absolutely. It's like a corset for your spine, right?
Yeah, it is exactly. Or a weight belt if you're a guy.
Yeah, true. Sorry, I didn't mean to be sexist.
So I got no. So basically, shoulders is something that we see a lot. When I went to that pain free, they prophesize that shoulder is going to eventually outweigh lower back as the number one pain related situation, I guess, out there, just because of our screen time. But you're saying work a lot of your postural muscles, work more posterior back muscles, and don't kind of have those imbalanced workout programs if you do, which is a strategy I use. I do a lot more back now because I have that problem and I have constant shoulder problems. And then core stability a lot is some of the basic things that you could do for shoulder and back, which I think we do quite a bit here. So that's an excellent thing. And hopefully wherever you're doing your exercise program or wherever you're working out at, you're doing those same aspects.
Right.
Cool. So, we obviously we have to decide because, like you said, we're not physical therapists. So we do work with people that have some pain. We always say if we didn't work with anybody with pain, we wouldn't have a job. So we do have to kind of go through that, and we do have to learn techniques to either work around it or not. But how do you feel about people exercising when they're through pain? Should they exercise with pain? Should they not? Should they?
I would say mostly no. Okay. I think there's a couple things that we see on the PT side where we're like, this is going to hurt, and I apologize in advance. So if anyone's had total knee replacements, they know that that's the case. Adhesive capsulitis or frozen shoulders, that's another situation. But oftentimes, if you're having pain, it's your body's way of telling you that something is going on. So I would say for the most part, no. A lot of times, even initially, I'll have people work through a pain-free range, basically. So they might do something that's a similar movement pattern, but they're staying within kind of that pain-free range. So I don't think, at this point that it's, like pain is a good thing or whatever. What's the little
no pain, no gain. That's
gain.
a lot of
Yes,
people's
that's exactly
aspect,
right. I would say
and
no. I would say,
false statement.
Oftentimes when people have that mindset, it just gets worse, and then they come and see us, and they're way worse off than what they would have been if they would have came a few months prior to. So I would say for the most part, no. There is a few situations where I think a little pain is not necessarily a horrible thing.
Right.
But if it is something
maybe
that's
like light arthritis or something like that.
Arthritis, and that's one of those things that you're with arthritis in general. I think mobility and stability is huge. So if you have a little bit of pain while you're doing it, but afterwards it's not long lasting, it's not limiting you functionally. It's a 2 or 3 out of 10, not a 6 or 7 out of 10.
That has a lot to do with it.
Absolutely. Pain. Yeah. Then I think that those times are maybe safer to have a little bit of pain, but with arthritis in general, I always tell people, motion is lotion, of course. Right. So movement is a good thing, right?
I noted that. Motion is
and then stability. So kind of like what you were talking about with the core, the importance of the core for the health of the spine. That's the same philosophy that you look at in arthritis in general. The stronger you are through those muscles that stabilize that joint, the better, because the less load's going through the joint itself.
Exactly.
So strengthening surrounding that joint is super important. So typically with those type of patients, we try to find things that are, easier, less loaded movements to start with, to get them to the point where they're stronger, to allow them to then move into those functional movement patterns and then not have pain with that.
Once again, a systematic progression and kind of moving them through that journey. You're so smart, Julie. We could do this all day. So you worried about it?
I know, right?
Like, what are we going to talk about? We have too much. We're gonna run out of time.
Right.
So, but potentially somebody, if they did have pain in a certain area, like say I had a shoulder problem, I may be able to still do legs or something like that. I could potentially work around
100%, yes. Injuries. And I oftentimes, people ask me oftentimes when they come in to see me is it okay for me to continue to work out or exercise? And the last thing that I want is for them to stop. There is so much more to exercise than just the physical aspect, but the mental and emotional, well-being, which is super important right now.
Yes, extremely.
So I would say yes. If I have somebody that's upper body, I definitely encourage them to continue to do strength training. Lower body, obviously there's certain things that I may not want, like if they're squatting and their arms in a funny position, like getting back in that extended position, and that's causing pain or something like that. But in terms of just kind of in general, yes, continue to do lower body strengthening, continue to do cardio, things like that. And I'm a little bit more aggressive. I'm a long distance runner, so I have that crazy little mindset. So when I have patients that come in that are runners or have a sport that they're, in love with and they do consistently and they've had some pain off and on, oftentimes I'll say, okay, continue to run, but let's try to add these things in. And if we get to a point a couple of weeks down the road, we're not making good enough progress, then I may back you off some, or then we may make some changes. But I'm not somebody that, the second they walk in the door, I say, stop what you're doing, because I know what it's like.
Right.
And if someone told me that, I'd probably turn around and walk away.
Peace.
Yeah. It was fun. Nice knowing you.
Yeah.
So
I don't blame you. Yeah. We hear that a lot with runners, that like their doctors say like don't run anymore. And a lot of them, that's like you said, that's a big part of their mental escape, the way that have, not for me, that would be torture for me, but I'd be like, okay, no problem, Julie. I didn't do it in the first place. But for a lot of people, we had actually 2 guests on here not too long ago that did, those ultra marathons, Crystal and Peggy, and they do the 100-mile runs, and they're telling me how sore they are afterwards. But to tell somebody that loves it that they can't or not to do that would be very, very difficult. But sometimes you just have to find the way, either work till you can get back to it, and you might have to pull yourself back and not continue, because we do have people out there like, I don't care if I'm in pain, I'm going to continue on the military or the crazies like you. No, I'm just playing. But something that you could still work yourself up to, hopefully eventually,
Yeah.
and not have to quit if you can get there, because exercise is
It's
a big
important,
part.
yeah.
Yeah.
And then just making, being smart and making modifications too, that's another thing.
Listen
I
to your
think that's
body.
really important. So, with runners, sometimes I may be like, okay, it's not the best right now. We can't continue to load the way we are, but let's put you in a pool and you can do some running in the pool, or let's change it up and do, some biking or something instead. So
Right,
there's
be
definitely,
smart.
Options. But the last thing you want to do is, take away their exercise as a whole, because then you might have a lot more problems than just their physical
Right, yeah.
issues.
Yeah,
So.
psychological is a big aspect, and so we don't have a therapist on the panel yet.
No,
so we'll have to wait.
right? I feel like I am one oftentimes.
Sometimes
though,
for me,
what we do.
that's a totally different thing. I only cried twice during our workouts.
Yeah, that's
and
true.
that was sad because I didn't eat Hertz donuts. I guess it was a bad thing.
And I beat you in arm wrestling, so you're mad about that too.
You always beat me in arm wrestling. Look at your shoulders. That's why. Thank God this is on YouTube, so everybody can see. Well, yeah, I mean, that's pretty much. I don't know if there's anything else that you really wanted to go over. I think we covered a lot of topics.
I would say so too.
You're amazing, Julie. It's awesome. I could talk to you all day just because I'm so fascinated by that. Physical therapy is actually really a world I wanted to get into, and I just was lucky to be in the personal training and get to taste a little bit of that. But that's why I say we're not physical therapists, because I always want to remind all the PTs out there, because a lot of us try to dip with that. And I think there's some gray areas where you probably work with a lot of people through exercise and give them some suggestions, and hopefully, post rehabilitation, we're kind of a place to go to, and why I got my post orthopedic exercise specialties. So it kind of allowed me to learn a little bit more about injuries, even though you're still teaching me words. What was the word today? What was the word that you taught me this morning?
Oh, Trendelenburg.
Trendelenburg, yes.
Yeah, that gait pattern. Yeah, you're right.
See?
Yeah, and that's something I think that's important for us as PTs too, because so much is dictated by insurance now, and you have a few people that are willing to do some cash-based services, but oftentimes we're not getting enough visits out of patients that we really want, and that's something that's been great. With our relationship with you guys, is to be able to continue to communicate what limitations that those patients have to allow them to safely get back into exercising outside of the PT world, and unfortunately we have to cut off ties sometimes sooner than what we want, because insurance no longer will cover PT. And so I think that's really important for people, after PT, is just to know to go straight from PT to jump back into everything you want to do may not be the safest route.
You have that
and
in between.
Yeah, absolutely. So finding somebody that can kind of help you make that transition, whether it's a lot of education with the PT, which I do. I mean, I do that all the time. I have patients that I'm kind of towards the end of their rehab, and I'll be like, hey, come back in 3 to 4 weeks. Let's check in. Here's my cell phone number. Text me next week after you have these 3 runs at this pace, because I want to know and then be able to progress them. And I think that's really important.
You care about people.
Yeah. But the same thing with you guys. Then it's really nice to be able to be like, okay, go to a personal trainer that will continue that communication and know, like, yes, you might not be 100% at this point, but you need to be getting back into exercise. You have these restrictions you need to continue to work through, and then you're allowed to do that safely,
Yeah.
So
that's kind of like that post orthopedic. It was kind of like physical therapist, personal trainer, and then on your own if you want to go with that aspect too. So it's kind of like that in between, the next kind of level in there, just to make sure that you get them back to where they're at, and that we safely are starting to progress them a little bit forward, and then they can handle those things. And like I said, it's also nice to that when we're working with people and we realize that it's just something that we can't handle, there's something that's going on a little bit more deeper, and we don't want to make sure that we keep them safe, because that's our main job, is that we have somebody to help co-manage and that we can send them to you guys. So that being said, I'm sure there's some people out there going, gosh, I'm in some pain right now, I need some help. I got a shoulder problem, lower back. Do you want to give a little bit of a marketing out there? A little plug for your business and a number?
Yeah. So like I said, we're located at 21st and Webb, which is just a couple miles away from Go Time. We have 5 therapists. We do a lot of, sports rehab and things like that, but we really see any patients. That's one of the coolest part of my jobs, is I get to go back and forth from, a little booger that's 7 or 8 that had a tibial fracture to a 93-year-old that I'm working on balance and gait and things like that. So, we do kind of everything in between. We are open long hours, 7 to 7. So my PTs are awesome. They work their little booties off. But I think the biggest thing that kind of separates us from a lot of places and stuff that I hear from patients oftentimes is just our investment. Like you mentioned, our PTs really care and develop great relationships with our patients. And that is, it's so much fun. And that's why I opened the clinic, was to be able to do that and give the type of care that, I wanted to. And it's been so much fun, and just a blessing for sure to be able to see that happen. And so we've, grown a lot, and it's been really cool. So we're happy to help anybody that we can.
There you go, guys. So if you need any help, hit up, Julie, True Physical Therapy.
Yeah.
It's amazing when you have those relationships, and it's great for us to be able to help people. So it makes us happy as well. So thank you so much for coming. This is post-workout. We're hanging out. I should have got you a shake. There's no post-workout shake.
Well,
if you don't know, she just worked out. So this is pretty good.
Yep.
She's not. I didn't put you through enough.
I know. I didn't get the makeup and hair thing that we were talking about. I was like, you're gonna make me work hard and sweat, and then go be in front of a camera.
You look beautiful. You did great.
Thanks. All right.
Thank you.
Yeah, thank you guys.
Thank you, Wichita. We love you. Have a good one.
All right. Thanks, Ray.
Thank you for listening to the Healthy Living Wichita podcast with Go Time Training. If you enjoyed today's show and want to get started with your own fitness journey, I'd love to help kickstart your goals. How do 4 60-minute personal training sessions for $99 with me sound? Head over to www.gotimetraining.com/podcast to claim yours. I can't wait to meet you.